And then another option that I found is the Primary Care Assessment Survey. This is available through Tufts Medical Center's Institute for Clinical Research and Health Policy Studies. The survey is free, but it's quite lengthy. It's 51 questions, and it does require approval by Tufts Medical Center. Part of the approval requires having a minimum sample size, which can be challenging for some of the practices to meet. You have to have 45 completed surveys per physician, so you have to decide whether or not that's something that's feasible for your, you have to decide if that's something that's feasible for your practice.
Okay. One thing I think I wouldn't recommend, unless if you have experience with a survey that's already there and that covers these topics that your organization developed previously, great, keep using it. One thing I never recommend is sitting down and writing survey questions yourself. There's a heck of a lot of experience and science that goes into developing survey questions. And it's almost always a better choice to use questions developed by experts. And you can, for instance, if you pull down the CAPS PCMH survey or the CAPS CG survey, there's even guidance to where you can cut questions out if you want to make it shorter. So that you can make a survey shorter but still have integrity as a survey and as producing results that will be helpful to you. Okay, I'm going to ask David then to unmute, and we'll see if there are any questions.
Survey mean?
Eventually it says
Hi, does anybody have any questions?
I do. Can you hear me?
Yes, go ahead. Who's this?
This is Kathy. I think somebody else was speaking too, but my question is brief. Can you quickly define what it means to field a survey?
Oh, sure. That means to send it to a defined number of patients. There's a lot of different ways to do it. You can mail it, you can email it, you can hand it out in the office, have them pick it up in the office, or even fill it out in the waiting room. But essentially that means to ask the questions of your patients and then to collect the answers.
This is Dr. Armstrong. I was just wondering, is there a set number of surveys that have to be completed? You mentioned one survey tool required 45 to be completed. Is there a set number with the others?
That's a good question. Peggy, can you answer that?
It does seem to vary. As far as I know, with the CAPS PCMH survey, I don't think that there's a minimum number. It has to be done sort of at a certain time of the year. That was the September, October that we were talking about. And then it will vary by survey tool and by vendor whether or not you need to have a minimum number of surveys completed for the other ones.
Okay.
The other thing to remember about the CAPS PCMH survey is that if you do use that one and you report the results to NCQA, they don't believe they have any intention of publishing anytime soon, but if you report the results to NCQA, you earn a special distinction that will show up on the website along with your NCQA recognition. Any other questions?
So one more question. This is Dr. Armstrong. So if we use the CAPS survey tool, we have to wait until September before we can even do the survey, correct?
That's correct.
So will we have enough time to then retool? You would have enough time to look at the results, to decide on something that you want to work on, and implement whatever the process might be to work on that, Okay.
and that you've implemented it. Yes.
So we'd get credit for implementing it, but we wouldn't be able to make the improvements and then retool it or ask the questions again, like
Right.
a post-survey.
Right. Would not be able to remeasure.
Okay, thank you.
Okay. It's actually setting the goals and making the changes that is must pass.
Okay.
Any other questions?
Yeah, this is Samuel Armstrong. You can do one yourself and then still do the one with a vendor, the CAPS one in September, October. Is that correct?
Yes, certainly.
Okay.
Can you talk a little bit, clarify a little bit more what the same-day appointment is? On that slide, I'm confused about same-day appointments. If you have availability of same-day appointments for people that need to be seen that day, but that's different from a new patient wanting to come in your practice, or or somebody that wants routine care. I'm not sure. Am I supposed to be having appointments available for somebody that wants a physical that day, or somebody that wants the new patient wants to be seen?
That is not a requirement. NCQA says you can set separate standards for acute care. You might say, our same-day appointments are for urgent or acute care, period. And we are setting a goal that we meet 90% of the demand for urgent or acute care. And then you might say with annual physicals, our goal is to handle annual physical appointments within 3 days. You can have different standards for each of these.
How about 3 months?
The important thing is to have standards for. What I encourage practices to do is to have a standard for either patients who say they want a same-day appointment, or patients who you feel need to have an appointment. Use that as a denominator when you're monitoring. So that sort of wraps all these categories into one. And you could say our goal is to meet 80% of them. I mean, you should take a look at the requests you're already getting. So on Mondays, if 20 people call you and 19 of those are for acute care visits, which is most of the case probably, you want to say, we'll meet 90% of the need. Okay, but advanced access is the gold standard. That's getting to the point where you're able to see anyone in the same day who wants to be seen. And it's called doing today's work today. It's hard to get to that. You don't need to get to that for NCQA. I'm just letting you know that that's what advanced access means.
Gotcha. Yeah. Yeah, it was. Awful.
Any other questions? Okay, folks. Thanks for listening. I know your coaches will be in touch, and you'll probably have a visit with your coach in April. So let us know by email if you have any questions that you didn't think of during the webinar. Okay. Thanks for listening, and put on your schedule, I believe the one in April is April 25th. So that one on your schedule, and we'll talk then about how you're doing with QI and access. Okay? Thanks.
That date is correct.
Yep. Okay, we can close the webinar now. Thanks very much, everybody.